Hi, thanks for stopping by today. Today is my last video, and I thank you so much for having watched the videos and taking charge of your health. Today I'm going to be talking about what I think some of the key factors are impeding upon our health care, and talk a little bit more about some of the things that we can do to help prevent some of these issues. One of the key factors, I think, is insurance companies getting too involved in the patient-doctor relationship and patient care. Insurance companies place so many demands and restrictions upon physicians, it's difficult for them to do their jobs. On the one hand, we need insurance companies, and they can certainly help detect and prevent fraud. But on the other hand, I do think they get a little bit overzealous, and I'd like to see them back off a little bit so that patients can get quality care. I also hope that all workers will get excellent training and residents sleep. And training, I think we need to have the importance of demonstrating how clerical errors can have huge ramifications for patients, and we've talked about this in a prior video. Just the other day, I received a prescription that said I can refill it 24 times by the end of the year. I don't think that that is correct. Now, I also hope that doctors will lighten up on attributing so many things to psychological reasons, and historically this was especially known to happen to women. And I've heard so many stories from patients about this, and it can tend to happen when a patient has a illness that they just don't know what it is. But if you think back historically, many years ago, decades and decades ago, there were so many things that we didn't know then that we know now. So to me, not knowing gives hope for the future that someday we may know what's going on with these people, and don't just attribute it to a quick answer that the person has psychological issues or so forth. It is one of the most appalling things to me that a physician can do to a patient. So if you're having trouble getting diagnosed, there are a number of things you can do. One is there is an organization called NORD. If you go online, you'll see it, National Organization of Rare Disorders, and get out there and see if there's others who have been in your predicament, and you may be able to find out a little bit of information. Or maybe the hospital you're going to isn't even familiar with that disease yet. Another hospital might be, so do some research on that. Don't give up, and don't stand for that when you know truly that you feel that you have something other than a psychological issue going on. Now, there are certain cases where there are patients that have such issues, but too many times, women especially, have quickly been given such an assessment. We also need to look at hospitals having better discharge instructions, as I talked in prior videos. This is a huge issue that greatly needs attention. I also think that we need to have more communication between doctors and patients. And we see this happening with the open notes that I discussed in a prior video, where patients have better access to notes now. And if you go online, there are chances for doctors and patients to participate online together regarding these open notes. But there needs to be more than that. There needs to be some type of seminars periodically at local facilities where doctors can better understand what patients are going through, and patients can better understand what doctors are going through. I also think it's helpful if doctors have a suggestion box in their office. Only one of my doctors that I knew of ever did this, and I thought it was a great idea, because there could be a lot of things that your patients could help you out with, maybe see things that you are a little bit blind to. So those are some of the issues I think are some of the key points out there that I think are bringing our system down, and especially the over-involvement with insurance companies. Now, for patients, what can we do? Well, one thing, I haven't addressed claims too much, but if you get a claim that you feel isn't right, don't be afraid to appeal it, and do that even if you have to do 2 appeals. I have had several times where I appealed, and I only won on that second appeal. And it's very important that you keep good notes, who you talk to and what, and these can help you back up your claim. So don't give up on that. The most important thing I think that patients can do that I've talked about in the prior video is speak up. If you're sitting in the doctor's office, or you left the office, or you have, sometimes you get a feeling like something just doesn't seem right. I don't really think I should be doing this. Speak up. Go back to your doctor and talk to your doctor about what's going through your mind, what your concerns are. If you have more questions, do not be afraid to speak up. The same way you would want to speak up if you had, for example, a parent in a nursing home. Well, speak up for yourself. It can actually save your life. Don't be afraid of that. And also, I stress the importance of getting your medical records, and I can't stress this enough. These days with the electronic records, if there is an error, and it could seem like a small clerical error, but as we talked about, these seemingly small clerical errors can have huge ramifications for you. Suppose the medication is listed incorrectly, or the dose isn't right, or there's a disease listed in those notes that you don't have, which has happened to me on some occasions. These things need to be spotted, because otherwise they will travel through the electronic records. And if you're suddenly in an emergency situation, you do not want doctors looking at errors that just are not stating the true facts. So be sure to get your notes. So those are some of my thoughts for today. And again, I deeply thank you for watching. And please remember to speak up. And I wish you the best in your health always. So thanks again so much. I very much appreciate it. Bye.